Good evening, all. I'm Aditi Lamba. Welcome to tonight's Vision of Asia, Voice of the Community. This is our daily South Asian news program presenting to you the coronavirus pandemic report. Coming to you now from a remote location in New York City, we continue showcasing top healthcare doctors and officials on ITV Gold, bringing forth important information and details on COVID-19 and its impact. Beginning the show, let's now take a look at some numbers. Today, more than 4.1 million cases of COVID-19 were recorded worldwide, with 286,000 deaths. In the United States, the death toll surpassed 80,000. Quite a sobering moment for the nation. We send our condolences to all who lost a loved one to COVID-19. Current number of cases in the country are more than 1.3 million. Again, we urge you all to practice social distancing and follow your local and state guidelines, ensuring your safety and the safety of others. Here in New York City, Mayor Bill de Blasio announced that the city aims to increase its COVID-19 testing capacity in the next few weeks, opening new public testing sites across the 5 boroughs. Currently, the city is conducting 14,000 tests per day. On treating coronavirus today, the World Health Organization said that some treatments appear to be limiting the length of the disease, and also said that the WHO was focused on learning more about 4 or 5 of the most prominent ones. Today, on testing, reliability, treatments, and much more, we have tonight leading medical professionals and our exclusive conversation with New Jersey Governor Phil Murphy. Here are the headlines. New Jersey Governor Phil Murphy addresses South Asian Americans on reopening, COVID-19 response, New Jersey. Dr. Dhruv Kazi on coronavirus updates, measures, and tips from Massachusetts. Sant Nirankari Mission organizes drive-through volunteer service, donating masks and gloves, Westbury, New York. Time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. I'm Aditi Lamba. This is Vision of Asia, special report on coronavirus impact, measures, and update. Beginning the episode, let's take a look at our recent conversation on coronavirus details and tips featuring Dr. Dhruv Kazi, who joined us for a virtual conversation from Massachusetts. More than 80,000 people have died from coronavirus in the United States, and today, top health official Dr. Fauci again warned about the risks of America reopening too early and to monitor for a spike in cases in regions with easing lockdown restrictions. Advising all on continuing social distancing, Dr. Kazi provided information on understanding this new normal with COVID-19, his take on testing, treatments, while also highlighting key developments of the virus and its growing impact.
You know, we keep on hearing in terms of COVID spread that we are reaching the flattening of the curve in multiple states. I know you're right now joining us from Massachusetts. We are here in New York City. Could you describe to us what exactly is happening in terms of flattening? And my question to you really is there an actual decrease in the number of deaths? Because, you know, at the end of the day, that's what most of the community is concerned about, to have a decrease in that.
Yeah, so I'll tell you that from the perspective of Boston, Massachusetts, we have seen flattening of the curve in action. We had our first cases at the end of February, and the city, particularly Boston, almost immediately shut down, put shelter-in-place orders. And we had been pretty much shut down for 5 to 6 weeks before our cases started climbing, which is, of course, different from New York's experience. Our cases climbed slowly. It gave us, our hospitals, time to prepare. Your audience will be aware of the fact that Boston is a very medical-centric city. We have a lot of hospitals, a lot of top-notch hospitals. And so we have a lot of reserve capacity. And we were able to use that reserve capacity for ICUs. To give you an example, our hospital, it's a 600-bed hospital, typically has about 70 ICU beds, and we doubled our ICU bed capacity to 140 over time. And because we didn't get a tsunami of admissions, we got the slow wave of admissions that we saw all over Boston and Massachusetts, we had the time to prepare for this. What does that mean? It means that we were able to provide ICU care for all of the patients who need it. And ICU care is not just about creating rooms, it's about making sure there's nursing, there are doctors, there's ventilators, there's all of the other support that goes into creating an ICU room or bed. And we would not have been able to do that if all of the patients who we eventually took care of had arrived on day one. So flattening of the curve is mostly because it allows hospitals like ours to prepare for the patients who are coming in. And I will tell you that I am very grateful for everything that Bostonians and the state of Massachusetts did to make sure that all of these patients didn't show up at the same time. In the long run, of course, we think that that saves lives, because when hospitals are prepared for patients and have the time to create ICUs, we can deliver better care.
In terms of critical care, Dr. Kazi, since we're talking about it, you have expertise in cardiology as well as you're working in the ICU. So you're pretty much you're on the front line here in this crisis. How has critical care changed in terms of patient care and patient taking? And what are some of those challenges you're currently facing, in your space at the hospital?
Yeah, and I would say that, so as you know, COVID is an interesting disease because it's, for the majority of patients, it affects a single organ, the lungs. And then in some patients, it involves a whole bunch of other organs, including the heart, the vascular system. There's evidence that the brain might be involved, other body systems getting involved. So as a cardiac critical care person, I'm seeing a sliver of the sickest patients who are not only in the critical care unit, but they've also had their heart involved, for instance, or there's concerns that their heart is involved. And the experience of our hospital has been unique because we had the time to prepare for it. Even so, I shouldn't sweeten the pill, so to speak. It was hard. It was hard to take care of a large number of patients, and we are really grateful for the fact that the numbers appear to have plateaued. And that's important for us to understand, that people who end up in the ICU are in the ICU for weeks. And so even when the curve starts to slow down, the actual number of patients in the ICU stays high until it eventually drops. And so we're at that peak plateau stage, but we're grateful that the numbers aren't rising. And it would, based on conversations with colleagues in Boston and in other hospitals in Boston and in New York, we've seen similar experiences. The other thing I would chime in here is that all of the hospitals in the US saw this other pretty interesting observation, which is that there was a dramatic reduction in the number of heart attacks and strokes that were coming into the hospital around the time that COVID was unfolding. Now, we don't expect COVID to protect you from heart attacks and strokes. And what was clearly happening is that people were trying to avoid hospitals. And there were, we were worried that there are folks who were having heart attacks at home or small strokes at home and not seeking care. We have data suggesting that that was indeed the case, both in Boston and across the country. What we're seeing now that the peak of the COVID pandemic has passed is we're seeing that those patients are coming back in. So we're seeing a lot more heart failure, a lot more heart attacks and strokes, people who were avoiding care in the past who are now back to receiving care. And so I think it's really important for folks watching this at home to understand that as much as our ICUs and hospitals are busy taking care of patients with COVID, they are prepared, as they always have been, to take care of people with heart attacks and strokes. So if you feel like you're having chest pain, you're having shortness of breath, you might be having a stroke, don't sit it out. This is the time to come into the hospital, because those things continue to remain life-threatening, and hospitals are prepared to safely provide care for you without actually increasing your risk of getting an infection.
On nonprofit activity now, the Sant Nirankari Mission New York chapter held a drive-through service of donating masks and gloves at its Center of Oneness in Westbury. This was a free distribution of masks and gloves to community in need, as well as the frontline heroes. Following social distancing rule, this drive-through featured volunteers of the Sant Nirankari Mission giving pre-packed supply of face masks and gloves, and also saw support and appreciation from members of the Westbury Police Department, firefighters, and the Mayor's Office of Westbury. The Sant Nirankari Mission focuses on empowered messages of universal brotherhood, oneness, and peace, and is comprising of multiple volunteer-driven activities, and is currently dedicated to a series of volunteer events in response to the COVID-19 crisis.
Good afternoon. This is Sadhika Chawla, and I'm reporting from the Sant Nirankari Spiritual Center of Oneness located in Westbury, New York. The volunteers of the mission have been giving back to the community in endless ways. They have been providing healthcare workers with free meals and also distributing free gloves and free masks. The mission's spiritual leader, Satguru Mata Sudiksha Ji, has been preaching love, humanity, and selfless service. The volunteers have been spreading that message through their actions. Let's hear from them and see how they've been implementing the teachings of their mission and giving back to the community.
Thank you. So to give this award, we also have our hero, basically, who is from the community. She's serving as a nurse, and she's a volunteer, S&M volunteer also. So this volunteer, she's doing a lot of charitable, activities like distributing this and preparing meals and then food donations, a lot of them. So let's give a big hand to Swathi Ji and from S&M side. I would request her to give this plaque to the Department of Police. Thank you so much. Thank you very much. We really can't thank you enough, actually, for whatever you're doing and for the community. Thank you so much.
We appreciate it. Thank you very much.
Thank you.
Thank you so much.
And we also have for the fire department. There are no words to explain. At one call, how you all come and save the community and serving, right? When everybody is coming out and there is fire and we see you, how you go inside, not caring for your lives, for loved ones. We really thank you from the heart. And we have similar volunteer here, Kiran Pandey ji. She has been serving selflessly day in and day out, and a silent volunteer, basically. You see how people always work behind the scenes. She's one of them. And we are really, really grateful to you, Kiranji. And again, big lot of applause for Kiranji. And I will accept this award.
Thank you. On behalf of the fire department, thank you.
Thank you very much. Thank you.
My name is Heena Chauhan, and I'm a volunteer with the Sant Nirankari Spiritual Center. I'm very fortunate to have been born into this mission, and we've always been taught to spread love and selflessly serve everyone around you. Today, even though we're practicing social distancing, I believe this pandemic has brought the world together. Baba Hardev Singh Ji used to say, humanism encompasses compassion, kindness, and spirit of being helpful to each other. Now is a perfect time for us to do that, whether it's by distributing gloves and masks to the community or providing food to the frontliners. As Nirankaris, this is our responsibility towards our global family.
Dhanakarji, my name is Heena. At this time, the world needs more love, and we should open our hearts to give in whichever way possible while following the local guidelines of our government. Seva during this pandemic is important because it demonstrates the belief of the Nirankari mission of equality and the importance of giving back to our communities regardless of race, color, and status. Small steps of selflessness leads to the great change we all wish to see in our communities and this world. I pray everyone is safe and healthy. Dhanakarji.
Hi, my name is Swathi Singh. I'm a volunteer at Sant Nirankari Mission nonprofit organization, and I'm also serving as a frontline healthcare worker as a nurse in New York. I've been given this opportunity to talk about our mission and my role as a healthcare worker. This mission has taught me a lot. It has taught me how to care for others selflessly, how to be there for each other, and how to spread love, especially during this time. This mission has distributed masks and gloves to the people who are in need. Also, we have provided meals to healthcare workers. This mission overall has taught me how to be a better human being and how to be a better nurse. Fortunately, we are seeing a decrease in the number of cases, but we must still take precaution to really end this pandemic.
It's time for another short break on Vision of Asia. Voice of the Community will be back shortly. Welcome back. This is Vision of Asia Coronavirus Pandemic Special Report, and I am Aditi Lamba. Now we have an exclusive segment of our recent conversation with New Jersey Governor Phil Murphy, who joined us virtually addressing the South Asian American community. The governor commented on the start of the reopening process in the state of New Jersey, his message for residents grieving loss of a loved one, and his take on New Jersey's economy. Governor Murphy stressed on increased testing in the state and a program for contact tracing to truly gather more insight into COVID-19 spread in the state. Thanking all essential and healthcare workers, Governor Phil Murphy reminded everyone of New Jersey community's resilience and strength. Here is the story.
Governor Murphy, would you please address, those people that have lost loved ones? I know even the South Asian American community, we've even lost doctors, in New Jersey, and they've done some incredible work. Just a word for the ones that are grieving.
Yeah, I mean, I speak every day to a handful of people who have lost loved ones. I just literally finished up making several calls. As you can imagine, they can get very emotional. The South Asian community has paid a big price. I spoke with a mom yesterday who lost she herself a doctor, lost her husband and daughter, and she has two other daughters, and they're also doctors, so 5 doctors in that family, and dad and daughter are gone. And the part that's really, in addition to the loss, which is bad enough, obviously, the nature of this virus is that you can't be with your loved one in their final days,
Yes.
and then you can't do a proper memorial or funeral service for them afterwards. So there's a feeling as though that it's not only a horrible loss, it's an incomplete horrible loss. And I would just say to each and every one of these folks, God bless you. You're in our prayers. Your loved ones will never be forgotten. And we are with you in solidarity.
Are there any facilities particularly being provided by the state for these families?
Well, it depends on who it is, obviously, and it does get down to the individual circumstances. So you've got the whole range of folks. I am concerned that our communities that are historically left behind, the communities that have less access to health care, that have disproportionate social determinants of health, which are not healthy, disproportionately congregated in small spaces, living spaces, disproportionately represented among our essential workers, invariably communities of color and immigrant communities. I'm very concerned that this virus has ripped open that reality as if we didn't know it already. And we're committed to making sure that we address that properly going forward.
If I was to ask you what the future of healthcare looks like for the rest of the year, in terms of patient caring, in terms of predicting what's going to happen for the next few months, what would you have to say?
Keep in mind that I'm not a medical expert, so I will give you my best judgment based on the inputs that we get. I think I'll give you the most, I'd say optimistic, but it's also realistic. It's achievable curve that I see. So we're in early May. I see the balance of May are the curves that we're watching carefully, the data that we're watching carefully, slowly but surely continuing to improve. I see further baby steps in opening up our state again. We opened up county and state parks last weekend.
Yes.
I hope we'll be able to continue to open pieces of the state up responsibly. I think we can have a steady summer, and I say steady, but it will be a new normal. So I think it'll still be a while before people are congregating inside of places. I think our healthcare system will get back to some level. It's still at a very high level of activity. There's still 4,000 something patients in hospitals from COVID-19 right now as I speak with you. 307 something people went into the hospitals yesterday with COVID-19. So I see that getting to a more stable place. And I think the other piece of this, Aditi, is that folks the medical experts would suggest that we may have some therapeutics that are specific for COVID-19 as early potentially as next fall. That would be a big deal. And then a year plus from now, which is optimistic, but you may well have a world where we've got a vaccine that's both safe and scalable. So that's a curve that may be optimistic, but I think it's within a realistic, attainable future over the next year.
And this is all for tonight's episode. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from a remote location in New York City. This is Vision of Asia. I am Aditi Lamba. Take care and be well.